Health experts warn North Queensland could be on the cusp of dual crises as the region braces for an influx of COVID cases and the summer disaster season. Let's go live to Jessica van Vonderen in Townsville. Jess, we've got a COVID scare in Far North Queensland tonight.
Yeah, hi Matt and welcome to Townsville. I want to take you first though to Cairns because earlier this evening Queensland Health issued several contact tracing alerts for the Far North region after a woman spent several days infectious in Cairns and Mission Beach. The 21-year-old woman had been in Victoria before flying from Adelaide to Cairns and then on to Darwin. There are exposure alerts for a Jetstar flight as well as a Mission Beach supermarket and the Cairns Central Shopping Centre. But Matt, it's also the start of cyclone season and today Townsville had its annual event to help the community prepare before the storm season really kicks off for the summer. People here are used to natural disasters, but this year there's an added threat, and that is the spread of coronavirus once the borders reopen to hotspots like New South Wales and Victoria. And authorities fear lower vaccination rates in regional centres will put pressure on already stretched health services. Lily Knopfling reports.
From storms to cyclones, fires to floods, natural disasters are a fact of life in Queensland.
There's the backyard, there's the pool.
But this summer, a new threat looms.
There is no doubt that we are seeing a cyclone off the coast already, and that cyclone is called COVID-19.
As the state's north braces for an above-average cyclone season, Queensland is also preparing to reopen its border, likely to bring an influx of infections into previously COVID-free regions.
So it is a potential dual crisis.
Low regional vaccination rates have health experts concerned.
The worst case is that communities are cut off from major centres and that people get sick with COVID and they have to manage that, maybe not even in their own home, maybe in a makeshift centre of some kind.
It really is a horror story.
Despite fears the virus could run rampant in cramped evacuation centres, Townsville's mayor says no one will be turned away, regardless of their vaccination status.
The reality is then we can't guarantee your safety if someone's in there with COVID and you're unvaccinated.
Local health systems are already feeling the strain. Last month, 4 North Queensland hospitals simultaneously sounded code yellow alarms because they were full.
We absolutely have the planning in place and the capacity to respond to dual surges in demand.
While authorities grapple with the COVID threat, insurance remains front of mind for many North Queenslanders. Premiums have continued to skyrocket despite a 3-year national inquiry into the cost and availability of cover. Motel owner Joan Mitchell watched her livelihood wash away in the 2019 Townsville floods.
Oh, it was devastation. Undescribable.
It took more than a year to reopen the doors.
And then the water went up to around about here.
And even longer to fight for an insurance payout. Her premiums then jumped from $12,000 to $26,000 a year.
I think insurance companies are a god to themselves. We're at their mercy.
The federal government has announced a $10 billion reinsurance pool to make cover more affordable in disaster-prone areas. It's due to start mid-next year, but the details haven't been revealed.
I'll believe it when I see it, to be truthful.
Lily Knopfling, ABC News, Townsville.
Well, here in Townsville, roughly 64% of people have had 2 doses of a vaccine, which is below the state average. About an hour and a half's drive down the road, though, at Charters Towers, just 49% are fully inoculated. Dr Michael Clements is chair of the Royal Australian College of GPs Rural Faculty. I spoke with him a short time ago. Dr Clements, you had a vaccination clinic today. What was the turnout like?
Sadly, we didn't see as many as we'd like to see and nowhere near the numbers we had at the start. But every vaccination we give is a good one. It's a great pleasure being able to help people navigate all the information and end up with a vaccine in their arm, because a little bit of work now saves us a lot of work in a few months' time.
What will it take to get the rest of the population over the line?
Well, I think a lot of the patients today talked about the inevitability. They recognise that at one point they're going to have to get it, whether it's for travel, whether it's once COVID is on the strand, whether it's once one of their loved ones becomes sick. So I think we're going to need that kind of restriction on our life that they've had in Victoria and New South Wales, where we've been locked down unless you're vaccinated. We're seeing that in Darwin right now. Or it's going to take a loved one to get sick. But we'd much prefer that people started off now with a vaccine rather than waiting.
Or perhaps an outbreak, would that spur people into action?
It certainly worked in the past, and if we look at New South Wales and Victoria, well over 90% first dose rates, you've got to think that there's something about the fact that the COVID threat is real, whereas when I talk to the locals here, even today, people are saying, oh, well, we don't have COVID here, we've been very safe, I don't plan on travel, I don't really need it. Thankfully, we're able to talk them into the benefits and say that it is going to come. All the evidence shows that it will become rampant by the end of next year, so the sooner we get this done, the better.
So given the low vaccination rates in some regions at the moment, what are the chances that when COVID comes, there will be lockdowns in places like Townsville?
The Queensland Health has been working very closely with GPs, and the message being clear to us that if we do have COVID on our streets here in Townsville with low vaccination rates, we're going to be locked down. So I think Townsville locals should expect that if we stay at these low rates, and we are low compared to the rest of the state, that we're going to have more lockdowns, more of us are going to be sent home from work, more closures, more restrictions on our freedoms. So the sooner we all get up to and catch up to the rest of the country, the sooner we can plan our lives.
We've seen some exposure sites today in Cairns and Mission Beach. What impact will that sort of potential threat have, do you think?
So for the health planners and ourselves, we know that this is going to happen. This is how it starts, one person travelling through. In Queensland, we've had lots of false starts where we thought we were going to get an outbreak, but we didn't. I think for the people of Mission Beach, I think their two-dose rate's about 58%. I'm really hoping that this wakes them up a little bit so that they recognise that it can actually come to their backyard and either make that booking or go to that walk-in centre as soon as they can so that next time it occurs, they're going to be protected.
And can I just ask you about Indigenous communities? How concerned are you about those?
It's a real shame. It's a shame on us that we haven't been able to get out there, get the message clear and invest time and energy. What we need is culturally appropriate messaging. We need to be working with the elders and the communities and find out what's the information they need and what's the way that they need it delivered so that we can get it done. I'm certainly pleased to hear of all the work being done on Palm Island, and we've got a lot of work in Charters Towers in the Adeline region to do as well. But we really must shift the focus away from those that have been offered into those that need our extra time.
Dr. Clements, thank you so much for your time.
Thank you very much.
Well, as I mentioned earlier, cyclone season is underway, and while wild weather is an inevitable part of life here in Queensland, we are being warned not to be complacent and to be prepared. Well, Jenny Woodward joins me now, and Jenny, you've been finding out more about this at the Disaster Ready Day here in Townsville.
I have, Jess, and there's no doubt that these communities in the north are some of the hardest hit by cyclones and flooding, and this Get Ready Day in Townsville has become a really important part of the calendar. It's an opportunity for new residents to find out what they need to do, but I also spoke to quite a few people who were keen to update their knowledge and make sure nothing's changed. A range of emergency services were offering really helpful advice and strategies that have been evolving over the years, and it really is important information no matter where you live. I went along to find out more. One of the perils of a Queensland summer. Townsville took a direct hit in 1971 when Althea crossed the coast. 3 people died and hundreds of homes were destroyed. The city and surrounds have also battled devastating floods, wild storms and bushfires. The Bureau recently issued their cyclone outlook for this summer.
An average season is 4 tropical cyclones forming in the Coral Sea, with one of those crossing the coast. So if we're looking at an average or an above average season, that means that we could see more cyclone activity than what we typically see. So with La Nina, we typically see more rainfall, which can also lead to more flooding.
The best time to prepare for a cyclone is now. What are your, say, 3 top tips for preparing your house?
Preparing your house. Try to cut trees and branches away from it so that they don't overlap the house. Clean your gutters and secure any loose items that would become missiles in a cyclone or storm.
Power is often one of the first things to go. and sometimes it can take weeks for services to be restored.
When people are going to be without power for a number of weeks, they often try and source generators and that kind of thing. So a lot of it is around our generator safety. When the storm passes through, be very careful when you go outside. As you can see just here, you can have quite a bit of grass and tree branches and debris down. It's very hard to see the power line running through there.
Of course, the Army play a big part in any disaster scenario around the country, and they've got a great display here today. We've got Wooly, the dingo. Hey, Wooly. He's the 6th dingo in a line of dingoes who are the mascots for one of the battalions here in Townsville. And, of course, we've got Courage, the eagle here, who has been on display this morning. It's been a great day out. Wild weather is frightening for us all, animals included.
You have to treat your pets just as you're treating yourself. So out of the wind, out of the rain, if there's lightning, out of the lightning.
And it's not just our pets we need to worry about.
Don't try and handle the wildlife, because once they are injured or once they're really worked up by the weather event, they will actually become a little bit more unpredictable.
Authorities say everyone needs a basic emergency kit, and it should include enough food and water for 3 days, a first aid kit and medications, a portable radio, a torch and spare batteries, and important documents. While we have no control over these powerful and devastating storms, being prepared can save lives and limit damage.
Jenny Woodward reporting there. And Matt, luckily last summer was pretty quiet here in Townsville compared with that terrible flooding in 2019. Certainly no one wants to see that again, but as they say, hope for the best and prepare for the worst.
Thanks, Jess, and Jenny will be back for the full forecast a little later. But let's look into how cyclones form. Always in the ocean because they feed off warm water, typically above 26.5 degrees. Then you need a cluster of thunderstorms which suck the warm air from the surface up 15 kilometres or more. And as that air rises, the air pressure beneath drops and the surrounding air rushes in. That can create new storms, intensifying this low pressure system which starts rotating. And when the average wind speed hits 63 kilometres an hour, it's declared a tropical cyclone. Due to the rotation of the Earth, cyclones spin clockwise in the southern hemisphere and anti-clockwise in the northern hemisphere, where they're called hurricanes or typhoons, but they're all the same phenomenon of weather. Now let's look inside. Some of the cool air at the top sinks at the centre of the system. That's where we get the eye. It's usually around 40 kilometres across, and this cooler air can be quite calm, and why people sometimes mistakenly think a cyclone has passed when it's just the eye passing over them. Around the eye is the most powerful part of the system, the eye wall, towering clouds and the fiercest winds. Outside that, huge spiralling rain bands kilometres long. So, how are they rated? It's based on maximum wind speeds and goes from 1, the weakest, to 5, the worst. Category 1 is a system with gusts of up to 125 kilometres per hour, enough to damage crops, blow over unsecured objects and make boats drag their moorings. Category 2 is from 125 to 164 kilometres per hour and can damage homes and blow over large trees. Cat 3 is when the Bureau starts calling it a severe cyclone, powerful enough to rip off roofs and turn debris into missiles. Category 4 is very destructive. There's significant damage to buildings and power lines are likely to be brought down. And then there's the most severe, Cat 5, where there are gusts of more than 280 kilometres per hour and widespread destruction. And finally, how do they get their names? The Bureau of Meteorology comes up with a list of names each season, alternating between male and female names, and applies them to any systems that form in their jurisdiction.